Welcome back to the Retire as You Desire show. Today's episode is all about living abroad in retirement. In the last segment, we talked about Social Security. What happens from a taxation standpoint? Do all countries accept Social Security? Could you be doubly taxed? The answer is yes. One of the things to avoid. But in this segment, if you want to live abroad, get out of the United States for your retirement years, your golden years, what do you do for health insurance? Have you ever thought about that? I could almost promise you that's one of the first things that come into people's minds is, how do I get health insurance if I retire outside of the United States? So when you turn 65 in America, you primarily receive your Medicare and your Medicare supplements if you need that as well, if your company doesn't provide that for you. So if you need to obtain health insurance, your Medicare is most likely not going to be an option when you retire outside of the United States. This is a great thing to know because it helps you plan. But planning for health insurance, it really revolves around a lot of steps. And these several steps and considerations are here to help you ensure that you have adequate coverage. Nothing's ever perfect, but you need to take your time here. So let's talk about some key options and strategies for getting health insurance abroad while in your retirement years. Now, when my wife and I were down in Argentina, because that's where she's from, it's a beautiful place. I would love to spend time there in retirement. But I got sick one time and I had to go to the doctor and they did all these tests. Again, completely different than the United States. My total cost, I remember this vividly, was $67 to have all the tests ran, get my medication. I just had a bad cold. That's what it turned out to be, but they did a chest x-ray to make sure I didn't have pneumonia. $67. In America, it would cost a heck of a lot more than that potentially if you have health insurance or if you don't. So retiring outside of the US may be a big benefit for you if you haven't saved enough money in retirement. But this all requires careful planning. It really requires careful planning. Because Medicare, as we had mentioned before, typically does not cover medical expenses incurred abroad. And that's a problem because you've paid into Medicare for, 30 or 40 years of your working life. But here's some great strategies and options for ways to obtain health insurance when you retire abroad. There is a way to get international health insurance. There are international health insurance plans that provide coverage worldwide, and it gives you access to multiple healthcare services in different countries. Some of them overlap into different countries, different regions. But there's also providers like Cigna Global, Aetna International, Allianz Worldwide Care, and IMG that offer plans specifically designed for retirees who want to live abroad, who basically become expatriates. Now, I don't offer them directly. We don't do health insurance at the Retire As You Desire with Bloom Financial Company, but there are ways to do this, and we want to provide great information to help you throughout your retirement years. Now, here's a fun part. Some of these plans are actually customizable. You can choose between different options. So they can include various levels of coverage, such as inpatient and outpatient care. It depends on your medical history, which is a big factor as well. Emergency services and prescription drugs. But you don't want to exclude your vision and dental. These two things get overlooked, but keep that in the back of your mind. Now, there's also local health insurance depending on the country that you live in. Many countries have private health insurance providers that offer plans to residents, including expatriates. And that's basically what you would become if you move outside of the United States. But understanding the local systems, a lot of this can be done by doing Google searches and looking these things up. And local plans are usually tailored to the healthcare system in that country, and they could be made more affordable. So if you have less of a medical history, you may not need all the bells and whistles. But if you do have a medical history, you want to research the specific healthcare system and insurance providers in your destination country to find something that's suitable for you, because you don't want to be stuck abroad, have no health insurance, or have a health plan. That could be catastrophic from a financial perspective and a health perspective. Now, some countries with national healthcare systems like Canada, they allow residents, including expatriates, to access public healthcare services either for free or at a reduced cost. This is a huge benefit, especially if you want to retire outside of the United States. Now, there's going to be different eligibility requirements for public healthcare systems, so this is something you definitely want to know before you move. And this may really depend on your residency status, your length of stay, and different visa requirements. Some countries may require you to contribute to the system through taxes or premiums, but if you're going to have health insurance, paying premiums may not be the end of the world. Paying taxes, though, this is where you need to understand your taxation on your Social Security and your investments. That's something we help plan with. Also, there may be short-term health insurance coverage. So some travel health insurance is a good option for short-term stays. So for instance, if you want to move to a country for 6 months and try it out before you actually make the bold move to do that, you may want to get short-term medical insurance. This could cover emergencies, accidents, and your routine care. You may get sick while you're there. That may happen. But the short-term insurance may be a good plan if you're testing out moving somewhere. Long-term residency insurance is designed for temporary stays, but it may not cover pre-existing conditions or ongoing medical treatments. This is a red flag. Understanding what's covered, what's not, depending on your pre-existing medical history, is important. Now, this is a good one too. Emergency evacuation. Some medical evacuation insurance covers the cost of emergency transportation to a healthcare facility in another country, or maybe even back to the United States. This is something that I've heard about people overlooking. And if you've had doctors all of your life living in America who have treated your heart or your cancer symptoms, you may want to include this in your insurance. So that way, if something major happens, you can come home on someone else's dime and it doesn't cost you a fortune. And then just like a Medicare supplement, there may be supplemental insurance with conjunction with other health insurance plans to give you a comprehensive medical plan outside of the United States, because maintaining US coverage is very difficult, if not available. So I've known some retirees to keep their Medicare coverage while they visit outside of the US for 3 months, 6 months, and especially their supplements. They paired this with their supplemental travel health insurance plan because it provided them with coverage for emergencies abroad. And that was their big worry. God forbid if something happens, how do we try and avoid any major financial disasters from that standpoint? So Medicare Advantage plans. This is something I definitely want to talk to you about. Certain Medicare Advantage plans offer limited emergency coverage outside of the US, but these are not a substitute for comprehensive health insurance abroad. So that's another thing to be very careful about. So you want to research where you're moving to. Do they offer healthcare coverage throughout the whole entire country? Do they have a universal healthcare system? And does it actually work for expatriates? It may or may not. But if you need a private option, how much does that actually cost? What does that investment look like? Because these policies, they may be expensive, they may not be. I think it all comes down to which country you want to live in. But these healthcare policies that are specifically designed for expatriates are a great place to start. You want to compare these plans. It's almost like buying your home and auto insurance, but this is so important because we're dealing with our health. We want to compare different international health insurance plans with their local insurance options that are available to find the best coverage for you and what's going to suit your needs in the most efficient way possible. Pay attention to copays, what are the total out-of-pocket costs, and what does this look like? Where can I get coverage? Does it include or exclude hospital services and emergency care? At the Retire As You Desire show, we're here to give you all of this information because we want to help people make educated decisions for their future. The Retire As You Desire lifestyle is all about living the life where you want, how you want, with who you want. And living abroad may be part of your plan. So I really hope this information is giving you a ton of value. And please tune in every Friday night, 6 p.m. Central Standard Time, same station, to watch this show to get great information about the Retire As You Desire lifestyle. And one of the big topics is, am I going to be taxed on my investments in retirement if I live in a country outside of the great United States of America? So that's what we're going to talk about in this segment. Now, so many factors to consider here, a ton of them. One of the biggest factors to consider is the country of your citizenship. If you receive a pension in another country, both in the US and the country of your residence, it may be taxed, and this may be a problem.